Not even an extremely gifted and experienced surgeon can reach excellent oncological outcome by itself if he or she doesn't have at disposal accurate imaging, preoperative and in some cases even intraoperative methods. The role of imaging is absolutely crucial nowadays for the level of provided care, in particular in oncology and especially in the management of pelvic tumors. The diagnosis is dependent on modern technology. It has undergone a rapid progress, and the task for the clinician is not only to decide about the proper radicality of the surgery and the select optimal regimen of chemotherapy, but also to find an optimal imaging modality for the right patient in the right time. We were used to taking for granted that prenatal ultrasound can diagnose even minor malformations. And currently, it's the time to acknowledge that ultrasound can bring us adequately precise information in the diagnostics and management of pelvic tumors. So-called expert sonography is an ultrasound examination by an experienced member of the oncogynecological team with appropriate training. Expert ultrasound has been playing a key role in the management of pelvic tumors, of all tumors, all stages, in all situations, in my institution in the last 10 years. We believed in a unique value of ultrasound even at the time when it was mostly used for the detection of hydronephrosis only. For such a strong statement of ultrasound positioning, we do have an array of significant reasons. We don't have to substantiate the economical aspect of it. It saves time. In the majority of the patients, it allows for deciding on the treatment modality in one appointment. It is less demanding for the patients. They are examined in one spot without the need of preparation or the use of contrast media. It gives a unique expertise to our hands, which is very useful in other situations, including management of complications, US-guided diagnostic and therapeutic procedures, monitoring the response to the treatments. Last but not least, the ultrasound conveys more accurate information than other imaging methods in certain fields. Let me mention one practical example of the change in the management in our clinical practice thanks to the use of accurate ultrasound. We have more than 400 new cases with malignant gynecological tumors per year in our institution. The majority of the patients undergo one single imaging modality only, which is expert sonography. Thanks to very precise description of the localization of the tumor in the pelvis, no single patient has been referred to either cystoscopy or rectoscopy or bimanual examination under general anesthesia within the last 10 years. Patients are typically referred to other imaging methods selectively only if there is a clinical reason, for example, risk of thorax involvement, if acoustic conditions are compromised, most often obese patients, if it is indicated by sonographist due to an unclear finding or atypical morphology. Recent publications showed that ultrasound in gynecological oncology is the most accurate imaging method in the differential diagnostics of pelvic masses. Comparably exact method with MRI in local staging of cervical cancer. Very accurate methods in the assessment of inguinal lymph node involvement in vulvar cancer. very accurate methods in the assessment of pelvic involvement in patients with ovarian cancer, including the assessment of rectosigmoid colon involvement. It is certainly not a correct statement that ultrasound could replace other imaging modalities. At the same time, it is nowadays not a correct statement that other imaging modalities can replace fully ultrasound. The aim of this DVD is to provide an overview of the potential of ultrasound in gynae-oncology. The authors of this DVD are the leading experts in the field and the authors of the key papers. The production of this DVD was supported by restricted grant from General Electric Company, and we are very grateful for that. Enjoy it.